In this video, we will review what is the oxygen content of blood, how do we measure it, and also how it is changed in various clinical scenarios, which is very high-yield concept for examinations. In order to explain this, we have to review the physiology behind oxygen transportation. We transport oxygen by the hemoglobin. Hemoglobin has 4 iron molecules. These iron molecules have +2 charge, and only iron with +2 charge can bind oxygen molecules. Initially, we have deoxygenated hemoglobin. In simple words, it's hemoglobin without oxygen molecules. To pick up oxygen, hemoglobin goes into the lungs. In the lungs, with inhalation, a lot of oxygen molecules income to alveoli. The concentration of oxygen molecules is described by the partial pressure of oxygen. In the lungs, the partial pressure of oxygen is 100, which is huge. This high partial pressure of oxygen makes able for hemoglobin to bind 4 oxygen molecules. With these 4 oxygen molecules, hemoglobin enters into the blood. And hemoglobin, where every iron has oxygen, we call 100% saturated hemoglobin. The oxygen which is located in our blood in bound to hemoglobin form, we call bound oxygen, and it's a major fraction of oxygen in our blood. In contrast to this, we also have free or so-called dissolved oxygen, which is a minor fraction. Both bound and dissolved oxygen are going into the tissues where they participate in cellular respiration. So, as we see, total amount of oxygen in our blood is simply the sum of bound oxygen and dissolved oxygen. Now, as we look at this formula, this makes sense. But you also have to know how to calculate the oxygen binding capacity. So, total oxygen content in our blood is the sum of oxygen which is bound to hemoglobin and oxygen which is dissolved in plasma. Oxygen which is bound to hemoglobin we calculate using the formula 1.34 multiply on hemoglobin and saturation of oxygen. And the sad part is that you have to know how and why we calculate bound oxygen. Because if we take total oxygen, the bound part is basically 99%. So most of oxygen molecules are transported in the bound form. So what do we have in this formula? First of all, it's 1.34. 1.34 is a constant, which represents the oxygen binding capacity of hemoglobin. Basically, each gram of hemoglobin can bind 1.34 milliliters of oxygen. So, fully saturated hemoglobin carries 1.34 milliliters of oxygen. Let's take a perfect condition. So, we have a normal concentration of hemoglobin, let's say 15 grams of hemoglobin per deciliter. 1 gram of hemoglobin can bind 1.34 milliliters of oxygen. So we multiply 15 on 1.34. And let's suppose that all hemoglobin molecules are fully saturated. So this gives us 20.1 milliliters of oxygen per deciliter of blood. But the problem is that not always all hemoglobin molecules are fully saturated. Sometimes some hemoglobin molecules carry oxygen and some are not. So how to be in this case? Well, if we take hemoglobin concentration, let's suppose it's the same 15 grams. We take our constant, but now we multiply on given hemoglobin saturation. Let's suppose in this case 98% of hemoglobin are saturated, and in this case oxygen binding capacity is 19.69. Another clinical scenario is anemia, where the concentration of hemoglobin decreases. Let's say hemoglobin concentration is 10 grams per deciliter. Constant is always the same, and let's suppose saturation is 100%. so all hemoglobin molecules are fully packed with oxygen. And in this case, even with full saturation, oxygen binding capacity is 13.4, which is significantly lower compared to two previous cases. So, as we see, hemoglobin is the major factor that determines oxygen binding capacity. But let's not forget that we have a small fraction of dissolved oxygen. Oxygen dissolved in plasma we calculate by multiplying constant on partial pressure of oxygen. 0.003 is the solubility constant of oxygen in plasma, and partial pressure of oxygen is basically the concentration of oxygen in plasma. So let's take the maximal partial pressure of oxygen, which is 100, and even at this oxygen concentration, the fraction of dissolved oxygen is just 0.3. Compared to 20 ml per deciliter of bound to hemoglobin oxygen, this is a very small fraction, which means that most oxygen is carried by hemoglobin. For examinations, we have to know how different pathological states in this table affect hemoglobin concentration, saturation of oxygen, partial pressure of oxygen, and total oxygen content in our blood. So let's discuss every condition step by step. In carbon monoxide poisoning, the issue is that carbon monoxide binds to hemoglobin 200 times strongly than oxygen. With binding, it causes formation of carboxyhemoglobin, and carboxyhemoglobin cannot carry oxygen. This reduces the amount of oxygen which is binded to hemoglobin. As a result, hemoglobin saturation decreases. For example, in this case, with 2 carbon monoxide bound to hemoglobin, oxygen saturation becomes 50%. With decrease in oxygen saturation, the fraction of bound oxygen decreases, which in turn results in decrease in total oxygen in our blood. Total hemoglobin remains normal because the issue is in functionality of hemoglobin. The lungs still oxygenate the blood effectively, which means that oxygen delivery remains normal, so partial pressure of oxygen is normal. In case of anemia, the concentration of hemoglobin decreases. With decrease in hemoglobin, there are less hemoglobin molecules which can pick up oxygen in the lungs. As a result, bound oxygen fraction decreases, which leads to decrease in total oxygen. The lungs are unaffected here, which means that oxygen delivery remains normal, so partial pressure of oxygen is normal. And oxygen functionality is unaffected, so oxygen saturation remains normal. In case of polycythemia, the concentration of hemoglobin increases. With increase in hemoglobin, there are more hemoglobin molecules which can pick up oxygen in the lungs. As a result, bound oxygen fraction increases, which leads to increase in total oxygen. The lungs are unaffected here, which means that oxygen delivery remains normal, so partial pressure of oxygen is normal, and hemoglobin functionality is unaffected, so oxygen saturation remains normal. In methemoglobinemia, some iron molecules becomes oxidized to +3 charge, and the problem is that iron with +3 charge cannot bind to oxygen. So if 3 iron molecules becomes oxidized, hemoglobin in this state can bind just 1 oxygen molecule, so oxygen saturation decreases. In this case, oxygen saturation becomes 25%. With decrease in oxygen saturation, the fraction of bound oxygen decreases, and as a result, the total oxygen decreases. The lungs are unaffected here, which means that oxygen delivery remains normal, so partial pressure of oxygen is normal, and hemoglobin concentration is also normal. In cyanide toxicity, the problem is that cyanide inhibits cytochrome C in tissues, which results in decrease in cellular respiration. So basically, tissues are not able to use oxygen. But everything responsible for oxygen delivery to tissues is unaffected. So every value here is normal because the problem is an endpoint, which is tissues.